How to measure skin fold size. The materials you will need will be a pair of calipers, pen and paper to write down your measurements. There will be a total of 9 skin fold sites, which must be precisely located using anatomical landmarks. A few things to keep in mind. Take all the measurements on the right side of the subject's body. Make sure that the skin is dry and lotion-free. Do not take skin fold measurements immediately after exercise. Before taking any measurements, you must first identify and mark the locations. When taking measurements, you must firmly grasp the skin fold between the thumb and the index finger of your left hand, 1 centimeter above the site to be measured. It will be 2 layers of skin and subcutaneous fat. Make sure to grasp the skin fold firmly. Place the thumb and index finger about 3 inches apart on a line that is perpendicular to the long axis of the skin fold. Make sure to pull the skin fold up and away from the body. Keep pinching the fold with your left hand throughout the entire measure. Make sure to hold the caliper in your right hand with the dial facing up. Place the jaws of the calipers perpendicular to the fold 1 centimeter below the fingers and halfway between the crest and the base of the fold, and release all pressure on the scissor grip while keeping the caliper perpendicular to the skin fold. Record the skin fold measurement to the nearest 0.5 millimeters 1 to 2 seconds after releasing the scissor grip. The tricep skin fold side is a vertical fold on the posterior midline of the upper arm. It is halfway between the acromion and the olecranon processes, with the arm held freely to the side of the body. The bicep skin fold side is also a vertical fold. This fold will be on the anterior aspect of the arm over the belly of the bicep muscle. The side will be 1 centimeter above the level used to mark the tricep side. Chest pectoral skin fold side will be a diagonal fold. For men, it will be 1/2 the distance between the anterior axillary line and the nipple. For women, it will be 1/3 of the distance between the anterior axillary line and the nipple. The suprailiac side will be a diagonal fold. It will be in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. The subscapular side will be a diagonal fold, done at a 45-degree angle. The side will be 1 to 2 centimeters below the inferior angle of the scapula. The mid-axillary side. For better measurements, have your subject reach over to his left shoulder. It will be a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method would be a horizontal fold taken at the level of the xiphoid and sternal border in the mid-axillary line. The abdominal side is a vertical fold 2 centimeters to the right side of the umbilicus. The medial calf side is a vertical fold. It will be done at the maximum circumference of the calf on the midline of its medial border. The thigh side will be a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Rotate through measurement sites and allow time for skin to regain normal texture and thickness. Take duplicate measures at each side and retest if duplicate measures are not within 1 to 2 millimeters. To calculate the body fat percentage in the body, for women you can follow this formula. For men you can follow this formula. This chart allows you to see the fitness categories for body composition. For women, this chart allows you to see the fitness categories for body composition in men. These formulas allow you to convert body density into body fat percentage. Although this is a great way to measure body fat percentage in the body, it does have a 3.5% error.